friends, I'm Adil, one of the faculties from BLISS Institute Sharjah, and I'm here for a video regarding important topics from OET Speaking. Let me explain ourselves first. And we are here for the last 16 years for helping medical professionals to attain their goals easily. And here we're helping for examinations, especially the international examinations like EMOCH, DHA have, as well as some language trainings like OET, IELTS, PTE, etc. And as well as we will provide some job placement after their successful completion of these courses. And regarding all help we can do for the all candidates we are approaching us. And we had a history of successful 16 years in this field too. And now, today I'm going to introduce you something regarding OET speaking sessions. So especially regarding the introduction. So many students are facing difficulty in introducing things to their patient. So we know that it is a role play card. Name itself, it is a role play. That means the candidate will be acting as a nurse. It's a registered nurse, and the interlocutor who will be the patient. So we have to imagine a dramatic situation. We have to imagine. Then as well as we have to read the question properly. So based on the question scenario, we can identify how we can introduce yourself to the patient side. Let me explain you something. Sometimes we will meet some patients who is first time meeting, and some hints are in the scenario itself that you are already familiar with your patient. In situations, we have to introduce ourselves. And some situations, it is not necessary to introduce yourself. So let us discuss regarding this. And always we can start the conversation with a greeting. So it is always good whenever we are starting a conversation with a greeting. And the first thing we will discuss regarding an introduction when you are meeting your patient first time. So that means you have to introduce yourself to the patient in a clear manner. That means in your explanation, your full name, especially the passport name, as well as your designation. That means you are a registered nurse and where you are. So this kind of things can be explained whenever you are meeting first time a patient. So whenever you are going through the scenario, there you can see somebody who is meeting you, or in any situation somebody who is meeting you for clearing their queries. That means you are meeting them first time. And then any patient who is meeting in the emergency situation. So but it is an emergency setting, but it is a non-urgent situation. Such situations you can also introduce yourself. That means you are going to examine the patient. So here you can explain yourself of who you are and what you are going to do. So this is an example. Then second one, it's a non-case. In that scenario itself, you can see some words like you have just diagnosed, or if it is a home visit, always we will be knowing that we know the patient. We had some information about the patient. So then you are not likely to introduce yourself. That means simply you can start with hello, okay Jack, or something like that. So you can call their name and then you can say that your assessment is completed. Now we will discuss on the tasks. So one by one you can analyze and introduce. And the candidates are always confusing regarding the name. So we can see so many videos in the YouTube regarding the introduction and all. And the thing is that it is not necessary to add something like that for the verification purpose. Can I ask your name? So it's something a wrong thing always you are doing. So OET is recommending 3 things in regarding the name. First thing, you can call their name as you wish. So any name you can call, so the interlocutor will accept it. And the second thing is that you can ask their name in between the 3-minute preparation time. And finally, you can use the interlocutor name. So these all are the 3 things you have to do in the case of name of a patient, or the interlocutor's name you can use likewise. So OET is recommending that you don't want to waste any more time to ask their name. Exactly, we have to finish the scenario and finish the conversation of 5 minutes with the assessment criteria. So these all are the important things you have to keep it in mind when you are meeting a patient and whenever you are starting a conversation in this. So I think this information will be helpful for you, and we will be meeting you in the next video. And for any queries, you can contact us in BLISS Institute Sharjah as well as BLISS Academy, Kottayam. And thank you for watching.